Last video, we look at how the market-based approach is used in US. In this video, we will look at how the shared responsibility approach is used in Singapore to finance healthcare. Singapore uses the shared responsibility approach. This approach tries to strike a balance between personal responsibility and the role that government plays in providing healthcare. Unlike the US, Singapore government intervene through the provision of basic healthcare and share the cost of some aspects with the citizens. However, individuals also have to be responsible in deciding their healthcare choices and expenditure. Our Singapore healthcare system is made up of both public and private healthcare providers. And our healthcare is financed through personal and collective responsibility, as well as the government provision of subsidies. Let's take a deeper look at how Singapore's shared responsibility healthcare system works. Firstly, Singapore believes in universal access to healthcare for all Singaporeans. It means that nobody should be denied healthcare services. It emphasizes on personal and collective responsibility in order to keep healthcare affordable for all. Singapore also believes in multi-tiers of protection. There are altogether 4 tiers. The first tier of protection is provided by heavy subsidies given by the government. It can be up to 80% of the total bill in acute public hospital wards. The second tier is the protection given by MediSave, and MediSave is a compulsory medical saving account. The third tier is through insurance in the form of MediShield Life and Integrated Shield Plan. And the last tier is MediFund. And MediFund is for patients who are not able to pay despite all the support that they have received from Tier 1 to Tier 3. And lastly, under the shared approach, Singapore believes in the organization of service delivery of medical services. The acute care is largely provided by the public sector. The general medical practice is largely provided by the private sector. And the intermediate and long-term care services are mainly provided by voluntary welfare organizations. And these organizations, known as VWOs, they are mostly funded by the government. In the previous slide, we have seen how our healthcare financing framework has multi-tier of protection. And this is to make sure that healthcare cost is affordable to all. And government inculcates personal responsibility, and at the same time, they try to provide subsidies and safety nets in the form of the 4 tiers for the lower income group. Provision of subsidies is also tiered to ensure that the lower income receive more support compared to the higher income. And all in all, we hope that no Singaporeans is denied access to healthcare. So what are some of the policies that have been put in place to make sure that healthcare is affordable for Singaporeans? There are altogether 4 policies. The first policy is government subsidies. What do we mean by government subsidies? It means that government pay an amount of money to help reduce healthcare costs incurred by Singaporeans. And of course, it is not free. The Singaporeans will have to bear a certain amount of costs. Subsidized treatment is available in public hospital, polyclinics, as well as community hospital and nursing homes. The Community Health Assistance Scheme, known as CHAS, is also a form of government subsidy, which is given to lower and middle income group. However, this group of people have to go through means testing. And what is means testing? It means that the government will have to determine the amount of subsidy based on their income. And these subsidies can be given at public hospital, outpatient clinic, as well as selected private GP and dental clinics. The second policy is MediSave. What is MediSave? MediSave is a compulsory individual medical saving account through our CPF saving. And who contributes to the MediSave account? It is the working Singaporeans and their employers. They contribute a part of their monthly wage into the account to save for their future medical needs. These MediSave help Singaporeans, and especially the low income, to pay for their share of medical treatment without any financial difficulty. The third policy is the MediShield Life. What is MediShield Life? It is a health insurance plan. This plan helps Singaporeans to pay for large hospitalization bill in the event they meet with major illnesses. And of course, individual will have to bear costs as well, as this is a co-payment scheme. The last policy is the MediFund. MediFund is an endowment fund funded by the government. MediFund is a safety net for needy Singaporeans who cannot afford to pay their medical bill even after heavy subsidies from their MediShield Life and MediSave. Besides the four policies that I have discussed in the previous slide, there are also new schemes which have been put in place to help reduce rising healthcare costs for the elderly as well as the low-income groups. In 2014, higher outpatient subsidy for specialist care and drugs were introduced at public hospitals and clinics. Besides that, the Pioneer Generation package have also been introduced to help the Pioneer Generation to enjoy special subsidies and MediSave top-ups. In 2015, MediShield was replaced by MediShield Life to cover every Singaporean from cradle to grave. That means the moment you are born, you are covered by MediShield Life. All these policies have helped to ensure quality and affordable healthcare for all Singaporeans. Although many policies and schemes have been implemented to ensure that healthcare is accessible for everyone, there are still challenges that Singapore faces in its healthcare system. By 2030, it is expected that our population will age. The elderly will need more intensive medical care, and they are more likely to stay in hospital for a longer period. Therefore, there will be greater need for healthcare services and improved infrastructure to support these elderly needs. How then do we tackle this problem of aging population having a burden on our healthcare system? We can actually look at the role of individual, government, and community. As individual, we need to learn to maintain a healthy lifestyle and diet so that we will be healthy, and that will be the best way to reduce healthcare costs. The government will then have to look at various ways of financing our policies and to provide more subsidies for the lower and middle SES group as well as the elderly. The community can look at how to provide further care and treatment to patients who are stable enough to be discharged from the hospital. For example, the Voluntary Welfare Organization, they can look into this piece of work. Furthermore, to manage the growing demands for healthcare, the focus of healthcare is shifted away from hospital and specialists towards primary care through family doctors in the community. This is to make sure that it is a more sustainable healthcare system. It also means that Singaporeans will have a regular family doctor which they visit often, and this family doctor will be able to understand their healthcare needs and are able to provide good medical care and advice. The other challenge that Singapore faces in our healthcare system is the rising healthcare costs. This is due to the global healthcare inflation. Everyone therefore has to share the responsibility in order to manage this high cost.